Hello, I'm going to present a short module on using spreadsheets to track treatment and also to improve staff and doctor performance. Spreadsheets are a little bit daunting sometimes. They're really not that difficult. It's just a way of keeping track of information in a very organized way. Now, I'll confess that using the spreadsheet initially is going to be a little bit difficult. Not quite as difficult as pushing the rock up the hill, but a little bit daunting and a little bit difficult. However, the hard work is really going to pay off in increased office productivity and ultimately making staff's job a lot easier. So you're going to use the spreadsheet to enter all the treatment plans that you present in your office. If you want to have a low minimum of, say, $500 or $400, that sort of makes sense, so you're not tracking all the really small treatment plans. But for every reasonable major treatment plan, you want to enter it in the spreadsheet so you can track it over time and you can keep track of your statistics. We're also going to play a little game here. Here's our dentist. We're going to have 3 different dentists. And we're going to have 4 different people, staff people, that present treatment. So we've got Donald, Huey, Dewey, and Louie that are our treatment presenters. We're going to measure performance, not only of the doctors in the office, but also of the presenters. And so what are the rewards going to be? Well, the doctor is going to make more money and the office is going to be more productive. But we need to talk about staff rewards too. Maybe that's going to be more money. Maybe that's going to be a bonus. We'll come back at the end and talk about that. What if you're the only staff person or the only doctor that presents treatment? You still want to keep track, not only to track your patients and track your treatment plans, but also to track your personal best. Are you better this month than you were last month? Well, we need to measure it to see. So here's what we're going to do. Back to our spreadsheet, we're going to enter the date and the patient's first and last name. Now I've narrowed the column there so you can't see the patient's first and last name, but you do want to enter them. You're going to enter the presenter and the provider. The provider's the dentist. You're going to enter the amount diagnosed and the amount scheduled. So the patient, you're making the financial arrangements, the treatment plan was $658. The patient says, okay. They understand their payment options and they scheduled. So you're going to put $658 there. If for some reason they did not schedule, you'd put a 0 there. You can enter where the treatment came from. For instance, did this come from recare, or is this a new patient emergency or a new patient exam? And also any comments that you want to put in there. There's plenty of room for comments because the text is going to wrap so that cell will get bigger and bigger, so everything will fit in there as you type it. Don't forget to save the treatment plan. To save the spreadsheet. Alright, so now you got this spreadsheet in here. What are you going to do with it? You're going to use it to follow up on treatment. We talked about that. So you've got one place where you can look for all the treatment plans that you've entered. It's right in front of you all the time. As you call a patient, you can put your notes in there. Patient schedules, you can change the scheduling from 0 to whatever dollar amount it is. We're going to use this to take advantage of what's called the Hawthorne effect. And the Hawthorne effect has been known in industrial psychology since about 1923. And what it says is when you measure something, it tends to improve. So if we measure our case acceptance, it will tend to improve. This really does work. We're also going to track who's the best presenter in the office and maybe see what his or her techniques are so we can improve everybody else. And again, maybe you're the only presenter, but are you doing better this month than last month or the month before? And how's your doctor doing? Is the doctor better at explaining the need for treatment so his case acceptance or her case acceptance is getting better each month? We want to track that and see. We're also going to use what's called a pivot table. Now, pivot tables are a little daunting also, but they're actually very easy to use and very slick, fast way to reconfigure your data so that you get some really nifty reports. So you just go to Insert and then up to Pivot Table on the upper left, and these are the results. This pivot table is showing where the treatment came from. Remember we talked about a new patient emergency, a new patient exam from recare or whatever, and you can see a new patient emergency, all those patients together, we're only getting about 66% of those patients actually scheduled. From recare, however, we're way up at 77%, and that's kind of what you would expect. And a regular patient who comes into the office, for instance, with a broken tooth, very typical example, we're getting about 75%, but we're clear down at 71%. Remember, these are all the patients. These patients are grouped in here. So all the patients that we saw for new patient exams during this time interval, we're only getting 71% acceptance. So maybe that's something we could work on, although I think these are fairly typical numbers. We can look at the provider. Okay, that's the doctor. Remember we had Curly, Larry, and Mo here. Well, you can see Curly doesn't do quite as well as Larry and Mo as far as case acceptance is concerned. Well, knowing Curly, that's not too much of a surprise. You can also see that Curly is not diagnosing very much treatment. Mo diagnosed $200,000 in treatment, and Curly only diagnosed $5,200. Again, that's probably not a big surprise knowing the Three Stooges. We can track presenters. Okay, remember we had Donald and Huey, Dewey, and Louie? If we look on there, we see that Huey is doing very well. He's got 86% acceptance of his treatment. He schedules 86% of the treatment for those patients. It looks like Dewey and Donald are kind of tied at around 73, 74%, but Louie is way down at 66%. Look at the difference between the case acceptance for Louie and Huey. There's 20% difference. That means that if Huey presents the case, we're going to get 20% more on the books than if Louie presents the case. Now, does that mean we want to penalize Louie? No, I think what it means is we want to have Huey and Louie talk to each other. Let's find out what Huey's doing right. Let's try to bring the whole office up. Now, yes, it's a little bit of a competition, but the most important number is down there where the total office is 74.71%. That means that less than 75% of the treatment presented by the whole office is actually scheduled. How about improving that number? That's the number that I think is most important when we're figuring a staff bonus. All right, so how are we going to use all this stuff? Now what? We want to sit down with our spreadsheet and with the appointment book at each staff meeting and say, let's look at the next 3 or 4 days or the next week in the appointment book. Let's look at our spreadsheet. Different people may remember different things about the same patient. It may be that the chair side says, oh yeah, that patient wanted to do this or do that, and that was never communicated to the person who actually presented the treatment. So putting your heads together and doing a little group think may be very effective, and this should be a habit at each and every staff meeting. All right, when you're consistently improving and meeting your goals, then what? Okay, well, this is where I think we think about staff rewards. Some sort of bonus system, some sort of a trip, some sort of sharing in the improvement of the office. Now remember, bonuses need to be based on improvement, not doing the same old thing. So as our percentage gets better, as our production gets better, that's the time to kind of think about a bonus system for the staff. That's beyond the scope of this particular presentation, except to use it as a little bit of a motivation. All right, that may have gone by a little bit fast. You need to sit down with it, play with the spreadsheet. Most important thing is to actually start using the spreadsheet. Don't worry about the statistics at this point. Use the spreadsheet to actually start tracking those treatment plans. That's a very, very productive thing to do.